Sir, we are live, sir.
Okay, today's meeting for novel 3-dose G protein vaccine. The ultimate key for rabies. May I audible to everyone?
You are audible, sir.
Thank you. Rabies is a major public health challenge in India because globally 59,000 human death annually, and this is the highest in India. India had 20,000 human death a year from rabies. That is 60% of the rabies death in Asia and 35% from globally. And 91% death in India in rural areas. Every 9 minutes, a person dies from rabies.
सिद्धार्थ जी आप ये कर दीजिए, स्क्रीन शेयर कीजिए.
Screen is already shared, sir.
हाँ ठीक है, थैंक यू.
Yes, yes. So, how we manage rabies? If a patient comes with a wound, first we local wound treatment, first aid. And this is the washing of the wound and made COVID-19 treatment. Then your active immunization, that is vaccine. Then passive immunization, that is rabies immunoglobulin. Our vaccine is two types. The 5-dose intramuscular regimen, that is SN regimen, and 4-visit or 8-dose regimen, in that is ID regimen, Thai regimen. Mainly we are preferring the Thai regimen, intradermal regimen. But it is the when post exposure prophylaxis we have in intradermal regimen, like non-compliance of the patient is the major issue. Four regimen or 5 regimen, patient took 2-3 doses and then missing 1 dose. Next, the potency. The potency of this regimen, very old regimen, and these are potency somehow inconsistency or impotency. Stability is low stable, and adverse effect. Some adverse effect are there. When we talk about compliance, these who received full course ARV, we called it fully compliance.
सिद्धार्थ जी ये मूवमेंट नहीं हो रहा है, स्लाइड मूवमेंट नहीं हो रहा है.
और स्लाइड मूवमेंट
ना सर, आप हम यहाँ से कर रहे हैं, आप मत कीजिए सर.
ये विश्वजीत,
नेक्स्ट स्लाइड प्लीज.
स्लाइड मूवमेंट इस स्लाइड तक का इस स्लाइड
This is the slide, sir.
इस स्लाइड
सपोर्ट सर ये करिए.
ಈ ಫೋಟೋ তুমি স্লাইড ये করনো.
This is the slide, sir. Are you talking
Slide,
about?
you are the moving the slide, I think.
Yes, sir. I'm taking care of the
इधर
slides,
देखो
sir.
slide
Next,
movement कीजिए.
next slide, please. Next slide.
Okay.
Yes, yes, yes. Then next on this side. Thank you. Okay, okay. If the next slide, I will come next.
Sure, sir.
Who received the full course of ARB, that is, he is fully compliant. And delayed compliant, who completed the schedule of ARB within 60 days but deviated from the scheduled regimen. If we are talking about 5 regimen, then he is taking 3 regimen and forgot one, and some days he then again tried. This is delayed compliant. Then non-compliant or dropout, who had taken at least one dose of ARV after minimal bite, then not completed all the scheduled doses. Next. In rabies, post-exposure prophylaxis, these are major issues in non-compliance or dropouts. There mainly we are if there is a street dog and this dog is killed soon, we give him 3 doses. Then this may be rabies encephalitis are there, and there is in rabies there is 100% death. So there is many studies in death of non-compliance to the 5 days. These are proven studies, various in platform. Next. Next. Yes. Here are some studies in New Delhi Safdarjung Hospital. There are from 360 animal bite patient and 53 are non-compliant to the full course of ARV. So next slide. These are all studies, and because we are the evolution of rabies vaccine, firstly we deal with a live attenuated vaccine. 1885, the rabies vaccine, these are nervous given in the nervous tissue, spinal cord. In 1911, they firstly inactivated vaccine. Then 1976, cell culture vaccine. These are on we are giving in hospital setup. The cell culture vaccine, inactivated vaccine, cell culture vaccine. Next slide. Next. Yes, yes. Next. So for this reason, the meeting the unmet medical need, introducing a novel vaccine with simple and shorter regimen, so that non-compliance will be minimal. So this is the novel 3-dose recombinant rabies G protein vaccine. How this is the technology novel 3-dose recombinant G protein vaccine. First protein subunit vaccine prepared from viral particle. This viral particle will multiply. Then it is the how it is the technology. Let it next slide. Yeah, this is the VLP technology. How the in a native virus the G protein is difficult to stabilize. So G protein isolation by VLP technology, then it is purified and stabilized by this here Cadila pharmaceutical. I think this is patent for the Cadila. Virus like particle are protein complexes. And this is the virus like particle, not the viral genome. So the adverse effect are maybe minimal for this. This they cannot replicate, but can minimal viral antigenicity without being pathogenic. They are capable of introducing strong humoral.
Sorry to interrupt you, sir. You are on mute.
Next slide, please. So, clinical study, phase 3 study. Here is safety and immunogenicity of novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as a stimulated post-exposure immunization randomized trial, controlled multicenter phase 3 clinical study. This is the study. Next slide, please. Here the study upon 800 subject with 533 subject with Travis and 267 with our reference Rabipur. This is the IM regimen, 5-dose IM regimen, 037 14 28. So this is a randomized trial. 2:1 ratio. Next slide. This is the result. In safety measures, Travis has a very less adverse effect, adverse effect like localized pain, redness, swelling, and systematic adverse effect very minimal, like fever, ear pain, headache, urticaria, joint pain, nausea, anything. Next slide. And efficacy is high, very high, right? So this is the study conclusion. Novel 3-dose was non-inferior to reference vaccine, less adverse effect compared to reference vaccine, and just 3 doses in 7 days. You don't have to wait for 1 month. That is our 5-dose regimen, SN regimen. Earlier, next. And this is the Cadila Pharma, India Pharma World Award given by Economic Times, and the Golden Globe Tigers Award, Malaysia, for Innovative Product of the Year.
Thank you, sir. Sir, thank you so much, sir, for your valuable time, sir. For the informative talk, we truly appreciate your efforts. Last but not the least, we would like to inform you that Thrabis has won the 2 prestigious awards in innovation category, ET India Pharma Award and a Golden Globe Tiger Award.
Yes,
Sir,
yes.
thank you for your time, sir. Kindly give some support to our Thrabis, sir, whenever you get a chance, sir. Also, more than number of this has gone live, sir. Lot of doctors are also in connection with the webinar, sir. Thank you, sir, so much for your valuable time, sir.
And
Very
thank you
soon
so
we'll
much. And thank you so much from the marketing team of the Cadila Pharmaceuticals. And it was a very great learning, and it was great insight for the Thrabis which you have presented, and it will be great exposure to all the participants who have attended on our back panel. And thank you so much for a valuable time, sir. And in fact, we have met during the Chilka, right? Right, Devakar?
Right, sir. Right, sir.
Yeah. In fact, I have met you, doctor, and it was very nice meeting with you. And thank you so much, doctor, for a valuable
Once
time.
again, sir. Thank you, sir.
Thank you. Thank you, Devakar. Thank you.
Thank you. Thank you.
Thank you, sir.
Good night, sir.
Good night.